For this video, we will continuing the previous video. The previous video, we already talked about the important mechanisms and the further metabolic activities and the importance of the copper in our human body. Now, we will talk about the daily intakes guidelines of the copper ions. We can go to the site of National Institutes of Health of United States. Okay, in here, they have a lot. They have the introduction, recommended intakes, sources of copper, copper intake as status, copper deficiencies, group at risk of copper and health and others. For this video, we will just talk about the recommended intakes, sources of copper, and copper deficiency. Okay, now we go to this table, recommended dietary allowances for copper. Okay. From this, we already know, from this table, it shows that 90 years old and above, you need to consume about 900 micrograms of the copper ions. Pregnancy 1000 is reasonable, but how about lactation? Why they need 1300 micrograms? Okay, we can take a look at the first things here. Birth to 6 months. When we take a look, birth to 6 months, they need 200 micrograms of the copper ions. Actually, in here, that not only copper ions, they need a lot of micronutrients. For example, sodium, magnesium, calcium, or even iron. They need this. But how they consume, how they get these micronutrients? It's impossible, right? If you tell your baby, hey, let's go, baby, go to chew, go to bite the cashew nuts, go to bite the hazelnuts, go to chase the cow and bite the cow. It's impossible, right? They don't have the teeth. They can't consume it by eating. So they can consume it from where? They can get it from breast milk, which means the mother body. So this is why when the mother having a lactation, they need to consume more micronutrients because some of the micronutrients already get consumed by the baby. Okay, now we go to sources of copper. Okay, sources of copper we already list out just now from the previous video. The beef, liver, oyster, baking chocolates, potatoes, mushrooms, cashew nuts, crab, turkey, tofu, chickpeas, salmon, and others. Okay, so we go to dietary supplements. Okay, if you are on diets, you don't want to eat the food, but you want to consume some of the micronutrients, then you can eat dietary supplements. For example, copper oxide, copper sulfate, copper amino acid chelates, and copper gluconates. The most common copper ion supplements is copper gluconates. You can get it from your nearest pharmacy. Okay, here we have copper intakes and status. Okay, we will talk about copper deficiencies. Okay, just now we already list out two important mechanisms, right? First is uh, the usage, the importance of the copper ions in the ETC, and the second one is hemoglobin synthesis. So if today you not enough copper ion, it will lead to anemia. Anemia, which means what? Not enough blood. Blood synthesis decrease. Hypopigmentation, it uh, about the melanin. Okay, the production of melanin also have the involve of the copper ion. Then hypercholesterolemia, connective tissue disorders, osteoporosis, and bone defects. Okay, connective tissue disorder, this is because if you don't have enough copper ions, it's difficult to form cross-linking collagen. Okay, so group at risk of copper inadequacy, we won't touch this, we won't. Okay, so that's all for this video and for the whole report. Thank you.